Hello, welcome to Module 6. This is the last module in this course. We will be learning about education and emerging technologies. There are a number of learner objectives. They include explaining the use of informatics strategies to facilitate nursing education at a distance, which is something that you're certainly familiar with by now as a distance student. To assess technology tools and delivery methods used in nursing education, to explore the use of simulation in nursing education, to describe bioinformatics, biomedical informatics, and computational biology, to outline the history of technology and informatics developments, and to describe state-of-the-art technologies of today that may be used in your specialty area or that may be used to help teach others in your specialty area. Now, there's certainly a lot of great things that come from technology, enhanced education, but there may also be challenges. One is certainly the financial side of things. Using technology, and in some cases, some schools have committed to investing in electronic health records to help their students learn. These are new expenses in their budgets. Many faculty are not prepared to teach informatics in different colleges of nursing or schools of nursing. Faculty who know how to integrate these new resources are needed, but they may not be available. And then we have certainly learned that technology needs to be integrated into both the clinical and educational workflows so we achieve the outcomes of ultimately of high quality, evidence-based, patient-centered care. We have learned that informatics, teaching students about technology or educating those that are already working in the field, it's not just about charting. It's not just about the idea of documenting with an electronic health record. And a lot of people seem to make that connection often. But it's related to the information system that in a way that supports practice and critical thinking. At this point, again, because as we've mentioned before, we have lots of data available to us and we have lots of ways to collect it now. Research and big data are very hot topics. Learning about how to analyze large data sets is becoming very important. The National Institute of Health has instituted a big data initiative. The University of Minnesota School of Nursing, they have a huge big data group that's comprised of a number of work groups in specific areas of informatics where there's a lot of work done related to big data across the country. We have informatics competencies. There are a number of lists that have been generated over the years pertaining to informatics competencies and how nurses should be prepared with regard to informatics. In many cases, those vary. So it's really hard sometimes to teach because we don't have all of that consistent across. There are different opinions about different things. And then there are different workforce roles, people working in different areas in informatics and in different roles even within the same institution. So there's a lot to consider in terms of sharing the role of informatics in nursing curricula. As we discussed early on, there's a science behind informatics. It comes from several disciplines. Now we talked about the convergence of nursing science, computer science, and information science in the beginning. But from this from your reading, the standpoint there, considering health informatics, there are lots of different disciplines that contribute. Computer science, decision science, information science, management science, cognitive science, and organizational theory. There are a lot of disciplines in healthcare that are related to with regard to informatics. And then we certainly have talked about the metastructures, the paradigm that supports informatics, including data, information, knowledge, and wisdom, and that continuum to help understand that. Now, in distance education, again, which you all are familiar with, there are certainly issues. There are different techniques and there's different applications. So technology and the internet are definitely affecting how we learn and how we might access information. There's an increasing number of nursing schools that are offering alternatives to face-to-face courses. So a lot of online courses being offered out there. And then it's also affecting how people learn and what is expected of them. Now you might hear these terms used interchangeably, but again, this is a situation where there's some distinctions. Distance education refers to instruction and learning that takes place when the instructor and the student are in two different settings and possibly two different times. You might hear the term asynchronous learning being applied too, but distance learning focuses on students who may be separated in time and space from their peers and professor. There are different tools that we might use to help educate health professionals. And on the hardware side of things, you've probably seen the interactive whiteboards that are in classrooms. E-readers and digital books would have, again, have made things very easy for us to carry around and access information when we need it or when we have questions. Our smartphones have certainly changed the way we do business. Tablets, our laptops and desk computers, and then clickers, which you may have seen if you're in a face-to-face setting in a classroom. On the software side of things, there are a number of tools, including learning management systems, which may be referred to as an LMS. There are proprietary options, such as Blackboard, which is what you use. There are open source management systems, including Moodle. We might use mind maps, digital portfolios, online and web-based testing, student journaling, gaming, virtual worlds, some of those things to help provide evidence that learning objectives have been met. Academic executive information systems also exist, and these are used to sort of get information to understand the climate that might be going on in an entire university system, where you might look at how many people have registered, what are the attrition rates, how well are we doing with recruiting, how well are we doing with retention, graduation rates, et cetera. Now, simulation in healthcare is certainly something that's being used a lot, and so we might see this in the educational setting, but we might see this in the clinical setting, which some people refer to as simulation in situ, where they might run a simulation in, let's say, for instance, a new unit that has not quite opened up yet, just to make sure all of the resources are there for them, the equipment is working, etc. So a simulation is really a pedagogical approach using one or more typologies to promote, improve, and or validate a participant's progression from novice to expert. These experiences usually include pre-briefing, a clinical scenario, and a debriefing, as it is the engagement part of a clinical scenario. And the clinical scenario itself is the plan that would be used during this experience, and it usually provides the context for a simulation. These can vary in terms of complexity, in terms of setting that's being described or simulated, the length. There are just lots of ways in which we can use these. Now, there are also different types of simulations, so not just the simulations we see in the sim labs in nursing schools, but case studies, computer models, and you may have seen Second Life. There are other computerized simulation programs that are available now on the market that are proprietary, require subscription. You might see the use of standardized patients, part task trainers, or medium to high fidelity patient simulators. Again, your reading will go into more in-depth explanation of these, so you'll learn more. Again, we welcome your questions, your ideas. We encourage you to reach out to us should you have any questions about the content that was shared in this module or the course.